we need to also know the glycemic index or the glycemic load of different food. Each and every food will have carbohydrate. We cannot have a pure protein kind of a food existing in this world. So each and every food item will have carbohydrates. Depending on the amount of carbohydrate in that, our body will raise the sugar levels after digestion. That is called the glycemic index. And over a period of time, slowly, gradually, how it increases, that is called the glycemic load. Okay, so these two factors we need to make sure that we consider. Each and different food items will have a different glycemic index and a load. We might think that rice, like rice is a broad category. Rice will have a higher glycemic load. That's why we reduce the quantity of the carbohydrate intake content is more in that. That is why the glycemic index is more. That is why we ask them to reduce the quantity of rice. Did you know that basmati rice will have a lesser carbohydrate intake content in it? Basmati rice will have a reduced glycemic index compared to normal rice, the short grain rice. So the diabetic short grain rice. Okay. So here is a mark where you can see high glycemic index will in very little time will increase the plasma glucose compared to a low glycemic index. Okay, so that is how the effect will be. Over slow and steady increase in the sugars will not spike up, will not require too much of glucose in insulin. Okay. So now the glycemic response to glucose versus beans. For example, we are stressing out what protein impact has on the glycemic index or the glucose intake. So the blood glucose. So over minutes, you can see beans they have this seed coat, right? Those seed coat of the beans, the skin of the beans will have fiber in it. That fiber helps in not increasing the sugar rapidly when compared to any other food. So slow and gradual increase will be there. That fiber will have lignins in it, a certain component, a fiber, a type of carbohydrate that slowly, gradually increases the sugars. So here are the glycemic index of different foods. Anything below 50 is considered recommended. Anything above 70 we have to avoid for patients who are diabetic. So you can see the glycemic load, like potatoes, baked potatoes with the skin, 56 they can have as a snack, but the quantity we need to designate it to them. Something like mashed potatoes without the skin, boiled and over processed, too much of free starch in it, so that has 88 glycemic index, so that is not recommended. Lychee canned in sweet sugary water is not recommended. Lychee fresh, smaller in quantities, they can have. Watermelon in larger quantities, no, but in smaller quantities, portion control is recommended. Similarly, orange juice is 57, but that's only 100 ml. So only when the patient goes into hypoglycemia, the sugar levels goes down below 60 mg per dl in the blood. Then only there, as a kind of medication, they can have orange juice or any other juice at that moment. So the whole orange compared to an orange juice is better glycemic index. Now, even Coke, 53. Diabetic patients, kids with type 1 diabetes, they will crave looking at their siblings or in a party to have Coke. You can measure out their carbohydrate content, their quantity of the Coke they can have, or any other cool drink they can have. They need not avoid it. Similarly with the ice cream. So how does it impact the low glycemic index diet and the metabolic syndrome? Metabolic syndrome is nothing but the impaired glucose tolerance, or the sensitivity of the insulin will be decreased, like in PCOS. So the insulin resistance goes down with the low glycemic index diet, the foods which we have seen. The insulin resistance goes down. The beta cell dysfunction, as the bombardment of hormones to increase the insulin production to the pancreas, they will be gradually decrease in the function of the beta cells in the pancreas, which produce the insulin. Okay, so that bombardment thing goes down, and there's no degeneration of the pancreas eventually if they follow a low glycemic index diet. There will be decrease in the blood lipids. that eventually leading to a reduced sugar levels or a controlled sugar levels. Similarly, there will be low fatty acids. In a low glycemic index diets, there's less saturated foods. So there will be a less fats in our bloodstream that will lead to lower and controlled cholesterol or lipids in diabetics. Then again, low glycemic index foods are mostly recommended which are raw. If you cook any food, it changes the nature of starches in it, carbohydrates in it. It will make it broken down. With the help of heat, it breaks down. But compared to having it raw, when I have something raw, for example, we cannot have raw rice, but we can have bleached out rice. The water can be thrown out. Okay, can be substituted with the B complex vitamins might be washed out, but B complex can be substituted with some other vegetable. But then when you have that kind of a rice, there is a reduced quantity of carbohydrates which I am taking in, okay, or any other diabetic. So there is reduced carbohydrate going in the body. That's why how they'll manage the glucose control also. So the inflammation also will come down if they are taking more of anti-inflammatory foods like omega-3 and 6. Green leafy vegetables are another source of omega-3 and 6. The other prothrombic factors which are induced by inflammation will be also reduced down, thereby protecting the heart of diabetic patients. This is a cumulative thing where protein, fat, saturated fats, as well as glycemic index, how recommendations are. So protein, as I said in the start, it's about 10 to 20% or 15 percentage of the total energy requirement of any patient. Then fat should be individualized, or it can be less than 35 percentage of the total energy requirement. Okay, and the saturated fat, we can hold it to less than 7 percentage of the total energy requirement, like ghee or butter. Cholesterol 200 mg per day or less than that is recommended. So our diabetic patients can have one or two boiled eggs in a day with the yolk involved. So having carbohydrates will be 45 to 60 percentage depending on what the person is at. For example, patient requires a weight reducing diet, I cannot give him 60 percentage of the total energy requirement. I need to reduce down the carbohydrate. We need to make sure increase the activity and give a little bit more of protein and micronutrients so that he doesn't feel fatigue, he's not devoid of the carbohydrates, and he will have a reduced calorie intake so that he can burn his fat from the body. Okay, so the glycemic index and glycemic load we have just discussed. Fiber again plays an important role. There's a recommendation of around 40 grams per day, both including the soluble and the insoluble fiber. But half of the 40 grams, 20 grams, should be from soluble fiber. Soluble fiber helps in lowering down the glycemic index of different foods, slowly, gradually increasing the sugar levels in the bloodstream. It also helps in reducing the cholesterol in the body. Now, coming to the second macronutrient, which is protein. I have mentioned before that sufficient evidence have been seen that suggests that the usual protein intake should be 15 to 20 percentage of the energy, but not more than that, because it spikes up the requirement of insulin. An individual with type 2 diabetes ingesting protein can increase the insulin response without increasing the plasma glucose concentration. Therefore, protein should not be used to treat acute or prevent nighttime hypoglycemia. Okay, so what is nighttime hypoglycemia? Patients who might take insulin along with their dinner, they might take it around 8 o'clock or 10, probably a 9 o'clock dinner. They take insulin, but not sufficient, carbohydrates. Okay, in their dinner time.